Good morning, everyone. On behalf of Psychology Department, I once again welcome you all to the lecture series on drug abuse, problem, management and prevention. Today we will discuss about nature of drug abuse, problem and overview. Let's start with the introduction part. First we talk about what is drug. Drug is any substance that alters normal body function. That is, whenever drug is introduced into the body, it always make modifications in the mechanism of our body. In broadest term, drug is any substance which changes the way the body functions mentally, physically, or emotionally. Now, drug can be defined in different ways. In medicine, it is referred to any substance with the potential to prevent or cure disease or to enhance physical or mental well-being. In medicine, drug is used for prevention and treatment of any disease or ailment. In pharmacology, drug refers to any agent that alters or modifies the biochemical or physiological process of tissue or organism. It affects body and mind both. How drugs are taken? Drugs can be taken in different ways. It can be inhaled into the nose through smoking. It may be injected into the muscle or veins. It can be swallowed also. It can be snorted also. Drug use. Every drug exerts effects on body. There is rational use of drug and also there is irrational use of drug. First, we talk about rational drug use. In rational drug is used in specific dose, in specific time period, as prescribed by the doctor or physician for treatment of any disease. Rational drug use always give benefit to the user. Whereas in drug misuse, drug is used for the purpose other than the purpose it was intended to use for, as prescribed by the doctor. That is, in this, drug is used in quantities less or more than the dose prescribed by the physician. For example, there are two patients, patient A and B. Both are suffering from similar kind of disease, but A patient is prescribed by the doctor a specific drug X 3 times a day. But B person is also taking the same drug without consulting a doctor. Then he is misusing that particular drug. Similarly, if A patient also uses that drug 2 times a day or consumes 5 times a day for that particular disease, then also it is a case of irrational drug use. For example, sleeping pills. Drug abuse. Drug abuse is global health and social problem. It is also called as substance abuse or it can be called as chemical abuse. There is a habitual taking of illegal drugs. Drug abuse leads to destructive pattern of using a substance which leads to significant problems or distress. Here, drug is used for recreational purposes and there is harmful use of drugs. Drug addiction. Now, drug addiction is mental illness or chronic brain disease which causes compulsive drug seeking or use. Individual is unable to stop using that drug. It is a state of utter and complete slavery and which can be outcome of drug dependence. It is a state of chronic intoxication produced by repeated consumption of that drug. Drug dependence. Drug addiction word carries some prejudice along with it. So physician prefers using drug dependence word instead of drug addiction. So it is a state in which user has compelling desire to continue taking drug either to experience its effects or to avoid the discomfort of its absence. It is a condition resulted from repeated consumption of a drug. There is intense desire to take that particular drug. Drug dependence is of two types: physical dependence and psychological dependence. In physical dependence, body become hungry for drug. Body is totally dependent on that particular drug for its normal functioning. It is also called as physiological dependence. Whenever individuals stop taking that drug, then he or she will feel distress or pain and discomfort. Whereas in psychological dependence, it is also called as emotional dependence, behavioral dependence, and there is mental inclination of that particular drug. Here, drug is used for well-being or for the state of intense pleasure and to avoid pain. Stages of drug dependence. There are four stages of drug dependence: experimentation, regular use, risky use and abuse, dependency. In experimentation stage, there is temporary use of drug. Here individual is using the drug for fun sake or maybe due to some peer pressure. Second stage is called as regular use. Here individual is regularly using that particular drug, but here also he or she can stop taking the drug also. Then comes risky use and abuse. There is very thin line between regular use and risky use. Here, the symptoms and risk factors of addiction and dependency continues to appear, and there is negative effects of drugs on drug user. Finally, he or she enters in a stage of dependency and addiction. Individual here is unable to stop using the drug because of its negative effects on the body and mind. Psychoactive drugs. Psychoactive drugs are the drugs which affects brain functions, resulting in changes in the perception, mood, consciousness and behavior. That is, it changes the way individual feels, individual thinks and how he or she will behave. It acts primarily upon central nervous system. Here, psychoactive drugs always affects the brain functions and causes modification in the brain structure. For example, cocaine, cannabis. Non-psychoactive drugs. It does not affect the brain when taken in normal doses. These are generally prescribed by the doctor for a limited time frame or for use on regular basis for chronic conditions. Non-psychoactive drugs cause little or no effect on the brain function. For example, antiviral and antibacterial. This was all about the introduction part. In the next video, we will discuss about prevalence of drug abuse in Punjab. Till then, take care. Thank you.